Welcome to the final Collaborative Community Conversations webinar from ITGA for Fall 2025. We are delighted to have participants joining us from across the globe, which reflects the interest in today's topic of conflict to connection. Today, we are joined by an expert from Arizona State University who will explore their approach for empowering student leaders to take on town gown issues. This session will be recorded and distributed to all attendees at the conclusion of the program. If you have any questions, please post them in the Q&A and we'll answer these either during or after the presentation. My name is Beth Bagwell and I'm the Executive Director of ITGA. And to quickly get us started about talking about the importance of this work, peer-led programs are important aspects of an institution's well-being strategy. Creating and sustaining these peer-to-peer connections can assist in enhancing group affinity and preventing high-risk choices. Arizona State University is an ITGA Great Place recipient, and she will share experiences in creating a peer health education program within an insular higher education population. Our speaker today, Brenda Young, Assistant Director of Arizona State University, is an alumnus of Texas A&M University and the University of Arizona. She received her master's in Public Health and Administration and Policy Development in her role as Assistant Director at Arizona State University. She has 20 plus years experience in higher education, focusing on supporting student well-being through health promotion, prevention, intervention, and recovery support efforts. As a prevention specialist, she utilizes public health strategies to reduce risky behaviors by enhancing protective factors in the environment. So, Brenda, we're going to hand this off to you.
Well, thank you, Beth, and hi, everyone. It's nice to be here with you all today, and thank you for coming and joining this particular conversation that's near and dear to my heart. When we think about higher ed and we think about communities and how we all integrate together, creating that caring community is just so important. And so there's many different ways that we can do that. And one particular way is really leveraging the power of our peers and that peer voice. And so I just want to kind of just start there and we'll kind of just continue through. And so since I am a public health expert, and that's really my background in training, I really want to start by just talking about the continuum of care, right? And we talk about this coming from the Institute of Medicine model. And so I think it's always important for us to go back to the foundational pieces that kind of drive the work that we do and why we do it. And so when we think about just an individual, right? And we think about the work that we do with those individuals, whether they be an individual or a small group or a larger group, or however we are interacting with them, it just becomes important for us to remember this span. And so we talk about health promotion, we talk about the importance of prevention. And so what are we doing in those particular spaces, right? Whether we're doing it at the community level within the cities, or we're doing it within the higher ed settings, and how collaboratively are we doing it together becomes really the important part of the conversation. And so health promotion, those are all very important topics, like just helping promote people to know how to lead healthy lifestyles, right? And then we talk about prevention. So what's in our environment that are kind of those risky choices that could derail an individual from being able to accomplish their goals and dreams. And so, sometimes we do it at a universal strategy. Sometimes we need to do it at a more selective approach, depending on who some of our target audiences are that might be at higher risk. And then sometimes we have indicated, right? And so those are the individuals we've already identified that have already adopted the high risk behavior. And we're trying to make an intervention happen at that indicated level and try to get them to, figure out where they're at on the stages of change model and be able to kind of intervene. There are times where people need to go into treatment. And so that becomes the next part of the fan. And then from treatment, we want to be able to keep people in recovery. And so that's really when we talk about the Institute of Medicine model and we talk about overall behavioral health, these are true foundation pieces that we talk through. And so this next particular slide, I really want to talk, and I want to just kind of ask you all to kind of think through for yourself. And I want to give you about 30 seconds to start making a list. What does your institution and or your city have that are peer-led initiatives, right? And so these are some things I want you to think through. Like, do you have peer coaching? Do you have peer mentors? Do you have peer education? Do you have peer counseling? And then we could continue that list, right? But there's so many different ways in which we have peers that can really truly have a voice within our organizations that this becomes an important conversation. Even our student employees, they are still peers, right? And so they are interacting with our with their clients, right? The people who are coming in and using the services, especially if they're in a student facing position, that becomes important too. So before we go too deep, though, I really want to talk about data because data is near and dear to my heart. I love data. Data is something that drives a lot of what I do. And in my opinion, when we talk about grants and in the grant world, this is what helps us establish and determine, are we making the impact we desired? And so that's why I want to spend a little bit of time with us first on the data part of it. And so we talk about use of data, right? When we talk about it's important for us to understand and know our populations, right? And so we want to be able to regularly assess our populations. We want to look at their population level. We want to be able to identify different priorities. Are we making progress in certain priorities, right? Where is that trending set, right? And so within a community or a city level, you all are probably already doing a lot of data collection, right? And then within the higher ed institutions, many higher ed institutions are also doing data collection too, just to get a regular assessment of what's going on with their students, who are their students, what are they bringing with them, what are they dealing with, what are they trying to overcome, right? And how do they perceive or see things within their own environment? And so, combining or looking to see how we can combine those particular data sources to really give us an overall view of not just higher ed, but the overall community at large becomes an important conversation. We also want to talk about, we use data to invest substantially in strategies with proven effectiveness, right? So the data tells us if it's effective or not effective. And we don't want to just continue to throw money at things that are not effective. So we want to always kind of go back to our data to help us make sure that what we're doing is making the impact we desired. We also talk about use of data when we talk about revision and discontinue strategies that are proven ineffective, right? And so that becomes important too, right? If something isn't making the impact we want, then we need to take a step back and we need to look back at our data, and try to re-strategize. Where do we need to go? What needs to be tweaked? So we can continue to move forward. And hopefully making the impact that needs to be made. And then when we talk about just determining how do we want to invest modestly, right? So in strategies with promising evidence, then evaluate and reassess, right? And so these all become really important things, right? So when we think about, if there's some promising evidence, things that we want to try, maybe we don't throw all of our money at it at one time, but maybe we try to invest modestly to see, is it really making the impact within our community, right? The community you're serving, is it making the impact there that it did in a different community when it was assessed, right? Do tweaks need to be made or modifications need to be made for your community? And that goes back to understanding and knowing your community and really following the data to help you tell that. And then obviously we talk about contributing to the broader movement towards an evidence-informed approach, right? And so I think that's a big thing, right? Is we have to continue to move forward to make sure that we're using these evidence-informed approaches as we are trying to make change within our communities. And I would like to say that these are all my lovely thoughts and that I came up with them. I didn't, right? And so you can see my source down there. And so if you haven't read What Worked for Improving Mental Health in Higher Education that was produced in 2023, by Abelson, Lipson, and Eisenberg. I highly recommend that you do that. It's a great resource and something that everyone should be reading. So we also talk about data when we look at longitudinal evaluations. And so now we looked at why we need to do data. Now look at the different types of data. So longitudinal kind of tells us, what are the kind of underage drinking rates, high risk drinking. These are all things that you can look at, right? To see tracking and trends over time. Experience of interpersonal violence, experiencing relationship violence, depending on what it is you're evaluating. These are examples, right, of data sources that you probably have access to that you could be able to pull out. And so you could pull from many different things, but these are just a couple of examples I want to be able to share with you. And so, these are how you can actually show and talk about the data once you actually go in and review it. So when we think about self-reported underage drinking, right, you can talk about, was there an increase or a decrease, right? And obviously for our particular grant, we want to see a decrease, right? So this is one way you can kind of write that assessment out. And we use NCHA data sets to be able to kind of tell us the impact that we're having. And then we talked about a 4.7% decrease in excessive drinking, and you can kind of see how we continue to go through, but I want to give you examples of kind of how you can write and talk about those things. Then we go into programmatic evaluation. It's like, was a program implemented as planned, right? And then we want to be able to determine where learning objectives met, right? And because that's important, because if you're going to put together something that's like an educational initiative, or even put together something that an individual has to complete, you want to make sure that it's being implemented as planned. And then you want to be able to measure change in the attendee, right? So you can measure things like confidence, perceptions, understanding, skills, abilities. All of these things are things that you can measure by asking questions. And then we talk about institutional impact, right? And so these are examples when we talk about, this is going back to like confidence. Can they make healthy choices? This is going back to try to do something to help someone, right? And so how confident do they feel in their ability to actually help someone? And then the third bullet point is really when to get involved, right? And so those were things that we wanted to measure. And so this goes back to, do they have the understanding, ability, and confidence to be able to do what we're asking them to do by educating and training and putting things in the environment to help reinforce the behavior we would like to see? And then this is just another way you can kind of represent is by using pie charts, things along that line. And so one of the things we were really trying to do was change the nomenclature and change the mindset of when we want people to actually intervene. And if alcohol is actually being intaked within an environment, we want to be able to keep people in mild impairment. And if we can start to intervene at mild impairment instead of waiting till increased impairment, then we have a better chance of keeping them at mild impairment. And so kind of just changing that narrative and getting our students to actually see that this becomes important for this type of first intervention here becomes a big thing for us and what we were trying to accomplish. All right, so that's data. So now we're going to talk about the actual leveraging of the peer voice. And so when we think about leveraging the peer voice, it's important that we think about what are ways that our peers are able to influence, right? And so when we think about the ways that our peers are able to influence, I kind of came up with these different 9 kind of things, right? So peers are able to actually raise awareness, right? And by raising awareness, that helps reduce stigmatization. So especially if you're dealing with an issue or a problem that has stigmatization, like someone who is in recovery from substance misuse, in some communities still has stigmatization attached to it. And so if we can help raise awareness, then that helps reduce the stigmatization that is attached to it. The more people understand and know about an issue, the less stigmatization that comes along with it. And it also helps just kind of flip that narrative and changes what people perceive as the norm. And so raising awareness is a huge ability for our peers to be able to influence. They also do that by utilizing the social norming strategies. So if you haven't done a lot of research on social norming, strongly encourage that, especially if you're working in the substance misuse world. Reinforcing the choices that you would like to see the individuals in your community adopt becomes more, that's what you want to be able to highlight, so that reinforcing those positive choices becomes the narrative. Then we talk about promoting healthy coping strategies, right? So that's another thing that our peers can do is they can talk about just, how do they actually, what's the nomenclature for that generation, right? We talk about different generations, we talk about different peer groups, right? And so, I don't always know. I like to think that I do, but I don't. I don't always know how to actually connect or use the right terminology or verbiage to actually connect with people who are, 30 years younger than me or 10 years younger than me, right? And so just understanding and knowing that they are there to really kind of promote those healthy coping strategies using some of the nomenclature that kind of grabs the attention of their audience, right? And then you're there as the expert to try to help make sure that everything stays evidence-based and evidence-informed in the way that it's presented. Sharing resources, that's the other thing that peers are really great at is, if peers know where to help send their friends, they will. Or they're individuals who are in their group or their spheres of influence, they will. And so and just raising that level of knowledge and making sure that they feel comfortable and knowledgeable and actually have them try some of the resources so they have first time experience sharing and talking about them becomes vitally important. And then ultimately, we want to be able to normalize help-seeking behavior, right? And so when we think about mental health, we think about stigmatization that might run with it, is really normalizing help-seeking behavior becomes really important. And so in a little bit, I'll be talking about a particular case study, and this becomes a very important part here is that normalization of help-seeking behavior within that population. Promoting self-screenings, right? And so those are all things that students can do, right? You can put out QR codes and students can talk about them. They can say, hey, I've done that. Self-screening, this is what I learned. Why don't you give it a whirl? It takes less than 10 minutes. Let's give it, see what you find out. Those types of things become really important. And then educating on risk associated with use, right? Oftentimes they want to hear from their peers. They do. That's who they want to hear from. And so if you can leverage those peers to be your educators who are actually talking about the risks associated with use, then it's their peer talking to them instead of a person of authority. And so sometimes that goes a long way in just getting that educational message out there and having people listen to it, actually apply it to their lifestyle and their choices. And then raising awareness on signs of emotional distress, and then building skills on how and when to intervene. So these are all things that our peers are able to do as we kind of move through. And so my challenge to you is, as you continue to think through, is what else would you add to this list? Could you come up with it, Tim? And so that'll be interesting to hear what you all think on that. And then if you have done a lot of research related to the importance of leveraging peer voice, then we know that Dr. Alexander Aston is he started his research back in the 1980s. And so this is not a new concept, is what I'm telling you. And so one of the biggest things that I kind of take away from his research is that students learn more and are more connected when they're involved in the academic and social aspects of the college experience. And so that becomes an important part for us to kind of just keep in the back of our mind as we're trying to address issues, is how do we help continue to leverage that peer voice? How do we help keep students connected, right? Connected to each other, connected to the academics, connected to the social aspects of just the college experience. So if you haven't heard of NASPA, NASPA actually has what we call the Certified Peer Health Educator Training. And you can actually have people become train the trainers for your area or your city or organization or higher education institution. And the nice thing about them is that they you go through this whole entire training. And so this was really the foundational piece that we utilize in training our peers across, whether they were used at the selective audience that we'll be talking more about, or even in our universal peer educators, right? And so we definitely use this model and this training as our foundational pieces. So the nice thing about them is that when we think about what we were happening is that we found this to be important because we were getting new peers every semester. And so we needed to make sure that we were keeping people trained up and that we had a good solid foundation training as our new peers were coming on. It also helps us invest in our professional staff by giving them that certified train the trainer certification. That's what we chose to do. And then it also just gives that student, they can hold that certified peer health educator training and kind of gives them one more thing on their resume as they continue to move through their college experience. It gives them more dialogue and topics as they're really talking through in future job interviews, things along that line. We also think through the training and evaluate. So this gives us the opportunity to really train and evaluate our students on various course content. So one thing you're going to hear from me is I don't believe that we should have peers in siloed approaches. I believe that peers should know all content and should be able to talk about all things. And when I talk about all content, I mean they should be able to have and be able to understand the you know how things interconnect, right? And so when we think about mental health and we think about substance misuse and we think about sexual and relationship violence, they don't all happen in silos. Oftentimes, there's interconnectivity, right, to when these experiences happen. And so making sure that our peers know how to handle all of these different types of conversations and even into hazing and other topics becomes so vitally important as we're going to continue through. But having these foundational pieces in the training allow us to be able to do that and kind of really train up our peers and have a process that we kind of push them through so they become those subject matter experts in all of those different content areas. And so then they see that interconnectedness of the content and they can stress that to their peers. And it also gives them an opportunity to sit for a certification exam and say one more thing to add to their resume. So let's talk a little bit more about the role of powerful peers. And so when we think about powerful peers, these are the people and the students or the individuals in your community that you kind of have selected that they're able to change the conversation. Their peers view them as leaders. They view them as people who are knowledgeable within the environment. They're people who have walked in their shoes. And those become important things when we talk about being able to change that conversation. They can promote upstream positive coping strategies. They can personalize content to the target audience. They can discuss without judgment, and they can integrate content into existing touch points. Ultimately, they're very dynamic. And if you have a great way of like assessing students and or building up their skills, you can really create some very dynamic individuals to be able to really make an impact within their communities. So I've kind of already talked to you a little bit about, the collaboration. But whenever you write for grants or anything along that line, and so you need to have that collaboration. And so within collaboration means that you have shared goals, right? And so that means that you sit down with the people that you're going to be writing your grant to be able to address, and you collaborate and you establish what are the shared goals that we're really trying to leverage, that we're trying to meet, right? That we're trying to achieve. And that becomes a foundation for moving forward. And so I'm going to share with you about our peers in action, and I'm going to use a case study that that we've had over at Arizona State University. And so peers in action really becomes important as we're kind of maneuvering through. But I want to share with you a timeline, because what I want to be able to share with you is this, and that is, we didn't just wake up one day and say, oh, we need to have this, powerful peer type of thing that went on. These types of collaborations and these types of shared goals, they have to start somewhere, right? And so I want to be able to share with you the progression, right? And so this shows you over a 3-year period of time, kind of the progression of the timeline of events and how things have been able to maneuver and move forward. So back in 2022 is kind of when we started with this whole integration of we were receiving the Great Plays grant, and we were able to really hire and train student athletes as paid student positions, right? And prior to 2022, I started working in this particular like shared collaboration space in 2018. So it took us 3 years to get to this point. And I think that that's important for you all to understand, is that sometimes things don't happen overnight. You have to be able and willing to invest the time and energy to be able to support and build those collaborations and those relationships that are necessary to make the collaboration successful. And so from 2022, then we moved into 2023. And so we were able to really start to see the peer health educators really starting to take off. They really were talking about substance misuse and prevention training. They were able to host health promotion programming within their space. And because if you know anything about athletics from a lot of institutions is very insular, which means that the student athletes don't go, they outside of classes, they don't really interact outside of the athletic space. And so this becomes important that we're able to bring everything into them, right? So anything that was going on universal across all of campus, we were able to leverage these peer health educators to be able to bring it in and put it into their little insular space. And so that was another thing that they were able to really start driving home in 2023. Then in 2024, we were really talking about expanding, right? And so this is where it's like, okay, we have a firm foundation now in substance misuse. We have everything built out the way it needs to be built out within this insular population. So now let's add the next topic, right? And so then we started moving towards, what's that intersectionality between substance misuse and healthy relationships, right? And so, so we started to move into that particular space. And then that brings us here to 2025. And so I'm really pleased to be able to share that, when we think through, as we're moving and we're continuing to expand the peer health education program, is what are those other content areas, right? And so when we think about expanding, things that we can throw into here is like hazing, right? Hazing prevention, education, making sure that students understand, how does that combine with violence and substance misuse prevention efforts, right? And so having these kind of more well-rounded, kind of all-inclusive types of conversations is helpful for our peers to be able to do that, so that as they're talking to their peers, they can help them understand the intersectionality of all of these different topics. And so I do want to share with you really quickly just the structure and organization, right? And so when this was built, we talk about, there was that collaboration I've been stressing. So there was our athletic administration, there was our Live Well networks, our well-being, our health promotion strategy types of things. And then what we found was, over time, we found that it was really important to have this management intern. And this management intern really helped ensure that this collaboration and connectiveness was important. And so what we also discovered was that the selection of the management intern becomes really important. And so for us, what we decided was that we needed a graduate student who had already been an athlete, but had finished their athletic career. And that became a very important recipe for us to be able to, because they were able to be viewed as their peers as a leader. They were able to understand the nuances within that insular population that needed to be addressed. And they were able to understand from a health promotion and prevention aspect, right, how the best way to be able to do it. So they were really a great interconnectivity person to help us kind of maneuver all of these things through. And then we had our peer health educators, right? And then what they were able to do was really work and understand and know what are those student organizations that already exist currently within that insular population? And then what are some of the leadership opportunities that are already existing? And so we don't need to build new stuff. We need to be able to have these peer health educators work and collaborate with the student orgs and those leaderships like the SAC committee within the athletic population. And then this is how we begin to actually make an impact within the overall student athlete population. So that's a little bit about the diagram. Feel free if you want to go into more detail, you can reach out and contact me after this presentation because I could talk about it for a long time. But these are some of the existing structures just really quickly that we have, right? And so your institution or your organization or your city may have more. But you need to identify who they are. And then within athletics, I think it is important that people understand the Student Athlete Advisory Committee, and that's the SAC. And so when we think about this particular group, it was really easy for our peer health educators to be able to understand that they are leveraging a very much a common mission. And so they want to be able to educate and connect athletes within their community on topics such as mental health, name, image, and likeness, career growth opportunities, right? And then within that, use where you start to tie in substance misuse prevention, violence prevention, right? All of those different things and topics. So we're going to take a few minutes and just talk about some different examples. And so different examples, going down to like health promotion basics, right? Do they actually understand goals? Do they understand the importance of sleep, refueling their body, hydration, recovery, time management? While those are all important for all students within higher education and really all individuals who are like maneuvering through life, all of these are very basic, important things. There are nuances within this insular population of athletics because they don't have, like, everybody only has 24 hours and they're juggling a lot within that 24-hour time frame. And so it became really important for us to be able to specialize and really talk specifically about these basic topics so that our student athletes could really understand and know how these basics fit in to their ability to achieve O2V, which is our drive, which is onward to victory, right? And so these become important topics for them to be able to see. We talk about the Eisenhower decision matrix, making the most of your day. We talk about when staying calm just isn't cutting it. What are some other extra stress relief tips kind of going through there? We do talk a lot about signs of emotional distress. This is something that we do not just with our students, but across campus. So anyone who works at ASU, we try to really elevate their knowledge when it comes to recognizing the signs of emotional distress. And so this is all information that came out of SAMHSA. And all we did was put it into a NICE CARES acronym, trying to make it a little bit easier for people to be able to understand or see, recognize those different types of things. We do talk a lot about across the entire university. We talk a lot about Hi, how are you? And that particular project, if you're not familiar with it, you can look it up. It's really a great initiative that has a background in like art and music, but also the support of overall mental well-being. And we talk a lot about just, how do you check in with each other? And so the importance of using open-ended questions, building in affirmations, building in reflections and summaries, right? And so building up these skill sets within our peers become important as we're kind of maneuvering through because we want people to check in. We want people to ask the question, hi, how are you? Not just in passing, but in an actual conversation that then allows them to dig a little bit deeper depending on the response that they get. And so this is just a couple more examples of like substance misuse prevention. You can see here in the middle, this is the BAC arrow that we use a lot when we talk about when to intervene. We want to be able to get them to intervene more in mild impairment. To other topics we talk a lot about are cannabis, alcohol, prescription drug misuse, those different types of things. We do talk about the importance of self-screeners. So if you don't have self-screeners available on your campus, I encourage you to look at a few, right? This is one example. This is the Screen U that comes out of Ohio State. They offer alcohol, cannabis, and prescription drug screening tools. There's also out of San Diego State, there's alcohol. It's called eCheckup to Go, and you can do it in like alcohol, cannabis, nicotine, other things. So there's a lot of different self-screeners that are out there. So you don't need to build your own. You just need to do your research and figure out which ones you want to be able to use. But I do highly encourage you to have self-screeners available to your students and have your peers be able to highlight them. We also talk a lot about knowing the signs. And so this is just an example of knowing the signs of a healthy relationship and an unhealthy relationship. We also talk a lot about just spectrum of relationships, right? And how does it go from healthy to maybe some unhealthy traits to potentially abusive, right? And so these become important conversations and just tools that kind of help us maneuver and help our students and our peers have these kind of conversations in the environment. Within this insular population, because we are a Division I athletic program, which means that our student athletes get a lot of attention outside of the university. And so that means community members, right? Things along that line. So we want to be able to not only help them understand the importance of setting boundaries and respecting each other's boundaries, but also understand stalking and stalking awareness. And so if you don't have January and Stalking Awareness Month, definitely encourage you to do something along that line. But these are just some different resources that kind of help our students have conversations with their peers on these topics. And then one of the kind of last things that I want to be able to highlight for you is a program that we call I'm All Ears. And so this was something that we provide within this particular athletic space. And so they pop up these banners randomly, periodically, and they just sit there and they're just a space for students to be heard and seen. And so oftentimes we forget that student athletes, while they're part of a team, sometimes can feel very isolated and alone. And so giving them a space where they can just come and talk about anything becomes important. And so that's really what this particular program does. It's just giving them that ability to kind of make some connections and have a chat. So these are different examples of different things that our peer health educators have done in different picture modes, things along that line. But I do want to be able to just share with you some feedback from the different student athletes. And so Lane Stallworth was one of our peer health educators. And so, when we talked with him about what he saw and what he felt as far as being a peer health educator and being the impact that he's been able to make within his own community, these are some of his thoughts. If people heard my experiences, they would see that they are not alone and that there are people out there who want to help. And so that again goes back to that help-seeking behavior we were talking about earlier, the importance of being able to build those connections, right? And to let people know they're not alone. And, they may feel like they're alone in their experiences because nobody's talking about it. But if people are talking about it, then they realize this is it gives some normalcy to the experience that they may be experiencing, and then helps generate that help-seeking behavior. And so Lane definitely was quite an asset to our team. Now, I do want to take just a few minutes and talk about, because we've talked a lot about how peers help peers, but now I want to take just a couple of minutes to talk about the importance of we have peers that we have now trained up, right? And they are our peers within our environment that are helping make some of these shifts and change that we want to see. to help improve whatever it is we're trying to look for improving, right? For us within our thing, it was really looking at, how do we how do we reduce substance misuse behavior, right? How do we increase the ability for people to be able to intervene, right? If behaviors are occurring in the environment, and knowing when to intervene and how to properly intervene in a safe way. And then being able to see that intersectionality between violence and substance misuse. And so by building these peers up, what are these peers taking away? And I think that's a really important part of this conversation is what are we building up within the peers that we're investing a lot of time and energy in to be in these insular populations. And so this means that we go back to the NANCE career readiness skills, right? And so these are the 8 NANCE career readiness skills. And I do believe that when we hire them, we are building these things within our student population, within our peer health educators that we hire, because we choose to hire them. That's what we've done in the past, is that we hired them and they were paid employees. And so these are all things that we continue to build within them as they're employed with us and being those peer influencers across their community. And so what is needed to drive a peer-led initiative? And so we think about that, really, it's trust, support, data, mentorship, selection criteria, making sure you're picking the right ones, and having a collaborative voice in the way that you select them. That was something that was very important, that we did a great job on making sure that was happening. And then robust training, and then obtaining the funding. So whether you're using internal funding sources or you're going out and writing grants to get external funding sources, or you have a donor who's able to give you external funding sources, or you combine with your city and you end up with a city-led initiative, right? However you choose to do it, but finding the funding source becomes important to how you want to be able to do this. So in closing, I just want to share with you kind of my dream, right? So my dream for leveraging the peer voices really goes back to this, and that is, my dream is that when we have peers in our environment and we select our peers within the environment, that we are training them up on all the topics that they need to be trained up on, so that when they're talking to their peers, they're not talking in a silo about one particular topic. They're really able to share with the peer how choices and behaviors can then almost become this domino effect and influence other aspects of their life. And so that's ultimately my dream, is that when we look across the globe, is that peers are trained up to talk about all different topics and can really understand and see that intersectionality and talk to their peers about that intersectionality, because the more we start addressing it holistically, the better the outcomes we will see. And so with that, I just want to say thank you very much, and I will turn it over to Beth in case there are any questions. And here's all of my references.
Well, this is so interesting. This is a lot of information, and I love your presentation. Two of the things that I really liked were "Hi, how are you?" project, and I think that's just brilliant. That seems so open-ended, and I'm all ears. I really like that. I thought that was. I'm glad that you included that in your presentation. I'm curious with all that we've seen in the last couple of years, with all that's going on in the environment, with post-COVID, how has your services increased on campus? Because I would think that you would have more students that you're seeing that are dealing with substance abuse. Is that correct?
Well, I think when you think through when you think about higher ed population, right? So it's not just about one particular entity, right? COVID itself, since that pandemic, really increased substance misuse across the board, not just for students in higher ed. And actually, we found that students who went home and stayed home actually had less substance misuse during that time. But now that they're back and they're back on campus, right? Sometimes they go back to those maladaptive coping strategies, right? And so how do we put in protective factors to help them overcome it? But throughout the pandemic, we definitely saw that just population wise, that we saw an increase in female substance misuse across the nation. And I'm sorry, I can't speak about the globe because I only really know about the US. So I apologize for anybody who's international. But who did a great job in 2023 of coming out with a really great report addressing alcohol and alcohol misuse across the globe, and really making the statement that there's no safe level of intake when it relates to alcohol. But so we did see, and we're seeing that pattern of like increase in female substance misuse. We are seeing that across higher ed. And so that's something that's happening. There used to be a pretty big gap between male substance misuse and female substance misuse, and that gap is they're about even now. Okay, and I think that that's important, is that this is not just one gender issue.
Wow, that's really interesting. I'm curious if anybody out there has any questions. I'm also curious about some of the other peer-led programs you have at your institutions. For those who are listening, if you have something that you would like to put in the chat, I would really appreciate, excuse me, in the Q&A, I would love to know about some of the peer initiatives you have. At least if you can include your institution and the name of the program or some of the programs you're doing. And while you do that, we still have enough time. If I could ask Brenda, if you could talk about first of all, if you could talk about the stigma. I know that there's a stigma in dealing with this. How do you deal with that overall? And I know a lot of these programs help, but I'm just curious if you have any more comments about that.
I do. And so one thing I think that is important when we talk about addressing stigmatization is that stigmatization doesn't just happen within higher ed. And this is really where we think about the city influence and the community influence. And it's really making sure that the higher ed is tied in with what is that community at large doing to really address stigmatization. And so for us, we leverage our different local coalitions that are across the communities, right? And so a lot of them were established in what we call the DFC coalitions, some of them. And so being able to leverage people like the Tempe coalition, right? Who are definitely addressing those different types of topics. Here in Arizona, we're very fortunate that we also have what we call SACLAs, which is a state. It's really like a state, almost like an association of coalition leaders, right? And so they do things at a statewide level and really push out very strong messaging related to stigmatization and trying to reduce stigmatization across the entire state. And so then when we think about from a city level is we need to be tying into those things, right? And we need to make sure that what they're seeing across the state, we're leveraging them and highlighting them within our own communities, whether that be our cities or our higher ed institutions, right? So that they're hearing it and they're seeing it from all angles. What we know about behavior change, whether it's being reducing stigmatization or changing thoughts or thought patterns or behaviors, is that the more impact or the more points of contact, the more effective it will be. And so if you have that overall inoculation process within your community, the stronger it'll be.
Well, I want to ask what's your biggest challenge, but I'm gonna switch that around to what do you think is your biggest success?
Oh, well, thank you. That's a nice way to look at it. I think one of our biggest successes, honestly and truly, is that um, we've built such a great collaboration, and I'm going to speak specifically to the example that I shared, that insular population within athletics. We really built such a strong relationship with them that it's great to see that we're now moving into, and the foundation has been placed, that we're moving into this atmosphere and this sphere to where they're now leading the charge, right? And they just have to reach out to us for consultation because they understand the importance of it. They've bought into it and they believe in the process. And I think that's a huge win.
That is. So, do you have any, can we get any final takeaways to the audience so that they can think about what your takeaways are and so they can uh, do something on their campus if they don't already have it?
Oh, great question. I think some of my final takeaway, and I'm gonna just quote somebody who I believe is a great leader within substance misuse prevention across higher education. That's Joan Masters out of Missouri. And Joan Masters has always said, build relationships, build relationships, build relationships, because it's the relationships you build that allow you to be able to have the sphere of influence to be able to help people understand the importance of the work that we do when we talk about substance misuse prevention, intervention, and recovery support. And we do that through, as she calls it, the 100 cups of coffee. And so I don't want to steal her little tagline because that's truly hers. But when we talk about relationship building, it's 100 cups of coffee.
Oh, I love that. I can imagine how that's effective because I love coffee. I love to meet for coffee. So I can see that's about building relationships, isn't it?
It is.
It is. Well, I can't thank you so much for you doing this presentation today and being our guest. This is such important work. The lives that you've impacted positively and the peers that you've taught that I'm sure will continue this throughout their lives. It is just so important. And we thank you so much for being with us today, Brenda.
Thank you. I appreciate the opportunity.
Okay, well, you have thank you again. And if anybody is interested in getting in touch with Brenda, I believe your information is in the PowerPoint. I will send that and you can follow up with her if any questions that you may have. And we will end this today. And I hope that everybody has a wonderful rest of the week and weekend and holidays.